Sabah al khair. Thank you all for joining us today on the first panel of the second day of the conference, given we know that this is a very busy period of the year, so thank you for taking the time to be with us today. The session is titled Social Protection and Economic Vulnerability. We will be presenting two papers, but first let me introduce myself. I'm Lina Nabarawi, the Social Policy Specialist from UNICEF Egypt. We have also here with us our distinguished panel, who I will be introducing very shortly. So today we will be discussing two papers. The first one is on the evolution of social protection in Egypt from 2012 to 2023 by Erin Selwenes and Hania Shulemi, and it will be discussed by Soraya Al-Asyuti from the World Bank. And the second paper is going to be on From Vulnerability to Resilience, Households' Exposure to Shocks and Coping Mechanisms in Egypt by Iman Helmi and Al-Anud Eheb, and will be discussed by Sekandra Kurdi from IFPRI. Now, these are two topics that I have to say are very close to me personally, but also given my role at UNICEF, both social protection and economic vulnerabilities. These are topics that are very timely these days. We have seen over the past few years multiple shocks that the country has been going through, and it is important to see how our families coping with these economic shocks, but also how the social protection systems, resilience and shock responsive, and are protecting children and their families from falling into worse economic conditions or using negative coping strategies to account for the income loss. Now, to my dear panelists, I hate to be the session that would delay the rest of the day. So then let me ask you to stick to the time allocated. And without further ado, let me give the floor to Erin Selwenes. Erin is the Associate Professor from the Faculty of Economics and Political Science at Cairo University. She has received her master's degree in quantitative economics and her PhD in labor economics from the University of Sorbonne. Her research examined economic development issues with interest in social protection, social policy, labor market analysis, and gender issues. Erin, the floor is yours and you have 20 minutes.
Good morning, everyone. I have worked on the evolution of social protection. Actually, it's from 2006 to 2023. So using 4 waves of the Egyptian Labor Market Panel Survey. And this paper is co-authored with Dr. Hania Shulemi, who is sadly not with us. Dr. Hania is an associate research professor at the Social Research Center at the American University in Cairo. So let's start by the first Sustainable Development Goal, which is to eradicate poverty. And under this goal, one of the goals is to implement nationally appropriate social protection systems and measures for all, including floors, and by 2030, achieve substantial coverage of the poor and the vulnerable. The ELMPS actually offers a unique opportunity for the Egyptian government and for Egyptian researchers to examine whether we are achieving substantial coverage of the poor and the vulnerable or not, and where are the gaps and areas to implement those nationally appropriate social protection systems, including floors. In this paper, we are going to examine patterns of coverage by different governmental social protection programs. The main programs that we focus on are social assistance cash transfers, and these are non-contributory. Retirement pensions, which are based on contributory schemes, which are based on past social insurance contributions and are employment related. The third aspect of social protection is having a currently working family member who is socially insured or who works in a formal job. And the fourth aspect is non-cash transfers, which is the food ration card, the smart cards. Now, there are 4 waves, and it's like 2006, 2012, programs were different than 2018 and 2023. So for social assistance cash transfers, which is non-contributory, 2006 and 2012, ELMPS have questions on existing programs at that time. At that time, there were Sadat and Mubarak. There were also recipients of non-contributory transfers, such as the Daman, Maash al-Daman. In 2018 and 2023, with the introduction of Takaful and Karama, new questions have been added to the ELMPS to cope with those newly existing programs. So we have questions on the receipt of Takaful and Karama, and we also have questions on the receipt of any remaining programs, which is other non-contributory transfers, such as the Daman Ijtima'i, with the background that Sadat and Mubarak are no longer there. So the first three, which is social assistance cash transfers, retirement pensions, and IUS transfers for the non-contributory, and pensions for the contributory. So don't be confused between those. So the first three, social assistance, retirement pensions, and having a socially insured worker in the family, allow us to measure what is called by ILO effective coverage. It's SDG 1.3.1 for those who want to check it in the ILO reports about social protection. The ILO reports measure it at the individual level. We can measure it both in the ELMPS. We can both measure it either at the individual level or the household level. But in this paper, we opted to measure it at the household level to know the household's effective coverage. And please note that the word effective is not about impacts on risk insurance, is not about impacts on reducing poverty or income redistribution, but it is about the scale and reach. So the word effective coverage is basically the proportion of households that are covered by any of those three, non-contributory cash transfers, retirement pensions, or having a formal working member in the household. This is what we are going to examine in this paper. First, the trends over time in coverage, in social protection coverage of households, of Egyptian households. Second one, are there any overlaps in social protection programs? Because the notion of effective coverage or coverage by any of the forms is actually, it's like covered by can be multiple, so can be covered by retirement pension and social insurance, or retirement pension and social assistance, etc. Using the panel data, we can examine dynamics of transition between different social protection programs. And we also focus on shifts between non-contributory schemes to contributory schemes. We are going to very quickly pass over values of transfers and pension and evolution over time in nominal and real terms. And finally, we are going to study the characteristics of social protection coverage by some household characteristics to know where are the gaps, who are the people, who are the households that are least likely to be covered. And that's where policy intervention should focus. And this is a summary of findings so that you know, fast forward, what's going to happen. Effective coverage, which is the proportion of households covered by any of the social protection coverage, has actually recovered in 2023 after continuous drops since 2006. By 2023, we have 58% of households covered by any of the three forms, either social assistance cash transfers, retirement, employment-related pensions, or having a formal working member in the household. So this is good news, right? Now, contributory schemes are a major source of protection for households. Most households have these, most households that are covered. But there are shifts in importance. There is more reliance now on retirement pensions than before, and less reliance on social insurance coverage, which is in line with declining social insurance coverage in the labor market and somehow deteriorating labor market conditions. Using the panel data, we also found that those households that were not covered by any of the social protection programs are likely to remain not covered over time. So the situation of being left behind is somehow persistent. And the data allowed us to also see shifts between non-contributory to contributory, and households who received cash assistance, cash transfers or social assistance cash transfers are less likely to have social insurance coverage in the next wave. Now, who are households that have the lowest coverage? Those are those households whose heads are unemployed, whose heads work in precarious types of jobs, such as private wage work outside of establishment, self-employed, to some extent unpaid family work, and employers too, and nuclear households with young children less than 5 years old, and what I call the missing middle, which is the second and third wealth quintile, household in those quintiles. So this is the summary of finding. Now, going more into details, this is the trends in households' social protection coverage. This is the percentage of households covered by non-contributory or contributory schemes. At the left-hand side, we have around 10% of households who receive now cash assistance, social assistance cash transfers by 2023. There are some dynamics going on with Takaful and Karama. In 2018, 5% of households were covered by Takaful and Karama. In 2023, we have around 9% of households covered by Takaful and Karama. This is actually very close to the estimates by the new Egyptian family survey, which reports Takaful and Karama at 9.7% of households too. Now, going to the contributory schemes, there are retirement pensions and at least one family member who works in a formal job. So as we saw yesterday in Mona and my presentation, households who receive retirement pensions are high. Like the proportion of households who receive retirement pension are higher over time, reaching around 29% of households in 2023. And social insurance coverage has very quickly declined since 2006. We had 46% of households who had at least one formal working member in 2006. That went down to 27% in 2018. But the good news is that fast decline has slowed down in 2023, perhaps due to the new social insurance law, and this is an area of further research. So now we have around a quarter of households who have at least one formally working member. Combining both to know the effective coverage or coverage by any of those three forms of social protection, we have that. So effective coverage is 58% of households in 2023, but so there was a decline in 2006 to 2018. In 2006, we had 68% of households covered by any of the three measures, either cash transfers, retirement pensions, or a formally working individual. That declined to 56% of households in 2018, recovered slightly in 2023, and this is the good news of the paper. As for the food ration cards, we did not have questions on that in 2006 and 2012, so we can't know, but we know that it is a stable coverage at 79% of households. Now, the effective coverage does not tell us much about whether households have multiple programs. This figure tells us whether households have multiple programs or not. So starting from the bottom is the mix between non-contributory and contributory. So we have non-contributory and retirement. We have non-contributory and social insurance, very light gray at the bottom, circled in red. This is the overlap between non-contributory and contributory, and you can see that it is small. It is 1 to 2% of households who can mix between those schemes. Much of the overlap is actually between retirement and social insurance coverage, but this is going down over time. And as you can see by the square, by the blue rectangle, the major reliance of households was on the labor market, whether through retirement pension based on social insurance contribution or by having a member in the family who works in a formal job or who actively contributes to a social insurance scheme. But the bad news is that that is going down over time. But stable in 2023. So it is good news and bad news. Bad news, it is going down. Good news, it is somehow stable in 2023. There is also a shift in the importance of within the contributory schemes. So more reliance is observed on retirement pension as of 2023, but less reliance on social insurance coverage in line with deteriorating labor market conditions. Using the panel data, we can track households. We know their status in the previous wave, and we can track the same households in the next wave to see what happens to the social protection access. Those can be the same households, so exactly the same households observed in, let's say, 2018 and 2023, or split households observed in 2023, and we reported to the status of the original household. So if we look here, the main message behind those two complicated figures is that those households who did not have any coverage, whether in 2012 or 2018, so 2012 is the left-hand side and 2018 is the right-hand side. So those households who did not have any coverage in the previous wave are likely to remain so in the next wave, and they are they are consistently the most likely to remain without any coverage in the next wave. So for example, 69% of those households who were not covered by anything in 2012 remained uncovered by anything in 2018. The good news is that this 69% of households have slightly improved. So it is in between 2018 and 2023, 62% of households who were not covered by anything were 62% of households who were not covered by anything were not also covered by 2023. So the proportion of households who are kind of stuck and left behind actually declined a little bit, meaning that perhaps there are some dynamics or there are some progress in expanding coverage to the left behind. And as you can see by the very dark gray, it is social insurance coverage that they are most likely to go in when they acquire social protection. Now, I'll skip quickly. This is the comparison between households who receive cash transfers, social assistance cash transfers, and those who do not receive cash transfers, and whether they can, in the next wave, have a formal working member. So we can see that households who do not receive cash transfers are more likely in the next wave to have a formally working member than households who receive cash transfers. This is not causation, this is only associations. This is patterns that we can detect in the ELMPS, and this is an important area of further research questions. About the values of transfers and pensions. What happens to pensions? Is it going up? Is it going down? What happens to transfers? Now, the dark bars are the nominal terms. The light bars are the real terms, and it is real in 2023. So we convert all those values to match the 2023 real terms. So you can see, for example, in the pension, which is the big graph, pensions in nominal terms are going up. But in real terms, it is not the case. In real terms, pensions are declining, and it dipped in 2018 before slightly increasing in 2023, but it did not return to the levels of 2006 and 2012. Whether declining real values of pension is actually making people not wanting social insurance coverage, this is a future research question that is worth examining. Now, what about social assistance transfers? Obviously, non-contributory transfers are much lower in values than contributory retirement pension, as expected and as it should be. So in like Takaful and Karama, 2023 is about 500 Egyptian pounds, as we know. In real terms, this is considered a decline from 2018. So this slide is basically saying that inflation actually erodes the values and the purchasing power of households, whether receiving transfers or pensions. Now, very quickly by household characteristics, and the objective of the exercise here is to know the gaps, where policy intervention should work. How can we implement the floors? What is appropriate social protection by type of household? Now, this is because yesterday there were questions about the sex of the head of households and the coverage patterns. We can see here that in terms of effective coverage, which is coverage by any of the social protection programs, female-headed households have actually higher coverage than male-headed households. But that doesn't mean they are more protected. That does mean that different tools are being received by male-headed households and female-headed households. For example, female-headed households are very much likely to receive retirement pensions because they're likely to be widows. Male-headed households do not receive as much in terms of retirement pensions. But looking at having like a socially insured worker in the family of female-headed household, this is 10% in 2023. And this is due to, as we studied yesterday, very weak women's labor force participation and employment rates. Now, the fact that the careful Yes, the fact that the careful cash transfer are given to women, even in households headed by men, meant that by 2023, both male and female headed households were almost equally likely to receive non-contributory transfer. That wasn't the case before in 2006 and 2012, where female-headed households were much more likely to take non-contributory transfers. Now, where are the gaps? Second and third wealth quintile. It's circled in red. Rural and lower Egypt, rural upper Egypt. Here are the gaps of intervention. In terms of labor market status of the head of household, heads with unemployed heads, heads who work as private wage outside of establishment, self-employed and unpaid family work, and employers have all kind of the lowest coverage. And children and families with a youngest child under 5 with no elderly have also much lower coverage rates. So these are the areas where national programs should focus in. Very briefly, key findings, signs of progress in coverage as effective coverage rate or the coverage by any of the social protection programs have recovered to 58% in 2023, mostly because of a surge in retirement pension, a slight increase in Takaful and Karama, and a slowdown in the declining trend of social insurance coverage. Challenges and gaps persist. Most importantly, those are remain left behind in the next wave. Some types of households are considerably less likely to benefit, middle wealth quintile, because they have very low chances of formal jobs, but also are excluded from the poverty targeting. Families with young children less than 5, families with unemployed heads, or those in precarious type of job, highlighting an important gap in the labor market for those people and in social insurance coverage for those people. And finally, chances finding formal jobs and shifting to contributory schemes are very low for recipients of cash transfer, highlighting either non-willingness of letting go of cash transfers or the inability to afford social insurance contribution, regular payments, and suddenly dropping off cash transfers. Or very limited chances of finding good quality jobs among those recipients of cash transfers. policy discussion around three themes. I'm biased to the labor market, so I'll start by we have to improve the labor market via social insurance coverage. We need to further examine and address the bottlenecks of social insurance coverage among employers and employees, while adopting a regional and gender perspective, as we see that women's employment is very weak. In some regions, formal jobs are very limited, so we have to adopt that. We have to safeguard and sustain the state's spending on social protection. Spending as a share of total expenditure has been dropping over time, and you can see that in the full paper. So there are ways to safeguard the state spending, and this is an area of policy intervention. Finally, strengthen and implement appropriate social protection floor. So fill in the gaps. The gaps are families with children, not in schooling, and to a small extent in schooling. So children-focused programs which tend to be less targeted but have more effects. We have to work on the unemployment insurance in Egypt. We have it in theory, but it's never, eligibility criteria are never met. So we have to work on that, activate it, and make sure eligibility can be met. And we have to work on expanding non-contributory schemes, yes. But in parallel with that, we have to make sure there are effective pathways to find formal employment and to transition gradually between that non-contributory to more productive and contributory schemes. Thank you very much. And these are the links for the full working paper, policy briefs, and my email for any further questions.
Thank you so much. Thank you so much, Irin. I think very interesting findings, some positive, a bit more concerning on the values, but also on the people who are left behind. Now, let's move straight to the second paper. It's going to be presented by Iman Helmi. Iman Helmi is an ERF affiliate. She was an Associate Minister of Social Solidarity for Economic Affairs and Financial Inclusion, and her fields of expertise includes policy analyses of poverty and inequality, employment and social protection. Iman will be presenting on the second paper, From Vulnerability to Resilience, Households' Exposure to Shocks and Coping Mechanisms in Egypt. Iman, you have 20 minutes.
صباح الخير. الحقيقة إن المحتوى بتاع العرض وبتاع الدراسة تم إعداده بالإنجليزي، بس أنا أفضل أتكلم بالعربي، فهقدم لحضراتكم دلوقتي الدراسة اللي شاركت في إعدادها مع زميلتي العنود إيهاب. واحنا بشكل رئيسي كنا بندرس تعرض الاسر المعيشيه في مصر للصدمات، بالذات انه الوقت اللي تم فيه البحث بتاع يعني السوق العمل التتبعي تم في فتره 2023، وكان بيسبقه طبعا بعض الاحداث والصدمات الاقتصاديه العالميه واللي اثرت كمان على مصر. فبشكل رئيسي الهدف بتاعنا في البحث ده ان احنا بنشوف ايه الصدمات اللي تعرضت لها الاسره المعيشيه، ايه اليات التكيف او الكوبينج ميكانيزمز، ودي برضو من ضمن الحاجات المهمه اللي احنا شفناها. هل ازاي الاسر كانت لما بتتعرض للصدمه بتقدر ان هي تتكيف مع الصدمه دي او تستخدم بعض الاليات المختلفه علشان تقدر ان هي يكون عندها صمود اكثر للصدمات او لا. والهدف من كل البحث ده او الجزء اللي احنا عملناه في الدراسة دي كان ان احنا نقدم أدلة لصانعي القرار وصانعي السياسات علشان يقدروا ان هم يعملوا استهداف مباشر لبعض الفئات من الأسر المعيشية اللي كانت أكثر تأثرا بالصدمات وقت حدوث البحث. زي ما حضراتكم عارفين احنا استخدمنا البحث سوق العمل التتبعي في استخدمنا الدورة بتاعت 2018 والأحدث كمان في 2023، وهي تم فيها يعني البحث على حوالي 17806 أسرة معيشية. ومن أول 2018 كان البحث بتاع سوق العمل التتبعي في موديول أو في بعض الأسئلة في الاستمارة الخاصة بالصدمات، كان أول مرة بيتم استحداثها في البحث بتاع 2018. وفي 2023 برضو كان نفس الموديول موجود مع بعض التغيرات اللي يعني هقولها بشكل مختصر جدا علشان ده هيأثر بعد كده على طريقة عرضنا للنتائج. على سبيل المثال في الدورة بتاعت 2023 تم استحداث سؤال خاص بالصدمات الاقتصادية، وهي تعرض الأسر المعيشية لارتفاع الأسعار في الغذاء والضروريات أو الحاجات التانية اللي هي ممكن تكون سلع ضرورية للأسرة المعيشية. وده طبعا كان بيعكس الاسعار اللي حصلت واللي ارتفعت والتضخم اللي حصل في مصر، علشان نقدر ان احنا نقدر نشوفها في الدراسة عاملة ازاي. الجزء الثاني الخاص بالأمن الغذائي، وده برضو كان موجود في 2018، ولكن الحقيقة في 2023 كان فيه تغيرات شوية مختلفة عنه، لأن السكيل أو المقياس بتاع الأمن الغذائي اللي تم استخدامه في 2023 كان مختلف، وكانت فترة التذكر بتاعته حتى مختلفة عن 2018 اللي كانت حوالي 4 أسابيع أو شهر. في 2023 كانت فترة التذكر هي تعرض الأسرة لدرجات مختلفة من الأمن الغذائي أو انعدام الأمن الغذائي على مدار سنة. وبرضو في طبعا بعض الأسئلة الخاصة بآليات التكيف زي ما أنا قلت لحضراتكم. وإحنا هنستعرض دلوقتي 3 أجزاء من البحث اللي إحنا عملناه. الجزء الأول هيكون خاص بالصدمات اللي تعرضت لها الأسر، بعدين هنشوف الخصائص اللي هي الاجتماعية والاقتصادية بتاعة الأسر المعيشية اللي تعرضت للصدمات، وبعد كده في الجزء الثالث هنشوف أكتر انعدام الأمن الغذائي، أو إزاي الأمن الغذائي بتاع الأسرة تأثر بالصدمات. بشكل سريع جدا، احنا شفنا برضو في الدراسة تم يعني الأخذ في الاعتبار أنواع مختلفة من الصدمات. بتبدأ من الصدمات البيئية اللي هي ممكن تكون خاصة بجفاف أو نقص في المياه. الصدمات الاقتصادية زي برضو ما قلت، طبعا الزيادة اللي حصلت في الأسعار، سواء أسعار الغذاء أو بعض السلع التانية اللي تعتبر من الضروريات بالنسبة للأسرة. المستلزمات الزراعية وزيادة سعرها. لو حصل مثلا انه تغيير في التوظيف بتاع رب الأسرة، ولو الدخل قل في الفترة دي. وطبعا كان في برضو بعض الصدمات الصحية اللي هي كانت بالتعرض للأمراض أو للتعرض لبعض الحوادث، أو وفاة يعني الشخص اللي بيشتغل في الأسرة اللي هو الشخص العامل أو رب الأسرة. دي كانت برضو كلها أسئلة مدرجة، بالإضافة لبعض الصدمات الأخرى زي التعرض لحرائق أو لسرقات وهكذا. الأدبيات المختلفة كانت دايما بيبقى فيه إطار نظري بنحاول نشوف فيه الأنواع المختلفة اللي تعرضت لها الأسر من الصدمات، وكنا برضو بنحاول إن احنا نشوف الأسر اللي كانت عندها هشاشة أعلى أو قدرة أعلى على إن هي ما تصمتش للصدمات فتتعرض للصدمات، وفي نفس الوقت يكون عندها آليات تكيف محدودة جدا. بعض الأسر التانية بتبقى بتتعرض لصدمات بس بيكون عندها تنوع أكتر في آليات التكيف اللي ممكن تستخدمها أو الكوبينج ميكانيزمز بتاعتهم. وبعض الأسر التالتة اللي بتكون عندها قدرة على الصمود للصدمات، فهو حتى لو في صدمة بتحصل بس هم قدرتهم على الصمود للصدمة بتكون أكبر. بشكل عام اللي احنا يعني شفناه في الدراسة بتاعت 2023، انه في حين انه في 2018 كان في حوالي 16% من الأسر المعيشية تعرضت لصدمات، ولكن الرقم ده ارتفع لحوالي 50% في 2023، وبشكل رئيسي هو نتيجة الأزمة الاقتصادية أو التعرض لصدمات اقتصادية، وبرضه بشكل أخص زيادة الأسعار اللي حصلت. لأن حضراتكم هتشوفوا هنا مثلا على سبيل المثال في الجراف ده، انه التعرض للصدمات الاقتصاديه في الاسر في 2023 كان حوالي 49% مقارنه ب 14% بس في 2018. وتاني زيادة الأسعار كانت حوالي 47% من الأسر المعيشية، وده مقارنة ببقية الصدمات الاقتصادية طبعا كان أعلى رقم تعرضت له الأسرة. وبالنسبة للصدمات اللي هي خاصة بالصحة كانت يعني رقم مقارب جدا ل 2018، ونفس الحكاية بالنسبة لبقية أنواع الصدمات. أغلب الأسر المعيشية تعرضت لصدمة واحدة، سواء هي صدمة اقتصادية أو صدمة صحية، لأن على سبيل المثال تاني 80% من الأسر اللي تعرضت لأزمة اقتصادية ذكرت إن هي تعرضت لأزمة واحدة بس اقتصادية، وهي بشكل رئيسي ارتفاع الأسعار. طيب الخصائص المعيشية الخاصة بالأسر اللي تعرضت للصدمات، احنا عندنا مؤشر للثراء، وقدرنا بيه ان احنا نقسم الأسر المعيشية 5 فئات من الأفقر أو الأقل ثراء للأعلى أو الأكثر ثراء. فحضراتكم هتشوفوا هنا مثلا في الرسمة دي أو في الجراف ده إنه حوالي 52% من الأسر الأقل ثراء في 2023 تعرضت لصدمات، وده مقارنة بال 46% تقريبا من الأسر الأكثر ثراء في 2023 اللي تعرضت للصدمات. فشفنا إنه الصدمات أو التعرض للصدمات أو الهشاشة مرتبطة بشكل رئيسي بمؤشر الثراء، وكمان بحجم الأسرة الأكبر، لأنه عدد الأسرة الأكثر من 4 أفراد كانت أكثر تعرضا للصدمات. وبرضو التعرض للصدمات أو الهشاشة كانت مرتبطة بشكل رئيسي بالمستوى التعليمي لرب الأسرة، لأنه المستوى التعليمي لرب الأسرة لما بيكون أقل من المتوسط كان أكثر تعرضا، حوالي 56% منهم في 2023 تعرضوا لصدمات، مقارنة ببعض مثلا الأرقام الأقل. لو مثلا نقول على اللي هو حاصل على درجة جامعية أو أعلى حوالي 47%. طيب الوظيفة أو مجال العمل لرب المنزل كانت برضو من ضمن الخصائص اللي شفنا إن هي أثرت على النتائج بتاعتنا، لأنه لما بيكون رب الأسرة بيعمل في مجال بشكل غير منتظم أو بشكل غير رسمي سواء داخل المنشأة أو خارج المنشأة، كان التعرض الأسرة للصدمات بشكل أكبر، حوالي 54% من هذه الأسر، مقارنة بيشتغلوا مثلا في وظيفة رسمية في برايفت سيكتور أو في قطاع خاص حوالي 45%. يعني في حوالي 10 نقاط مئوية فرق ما بين مجرد انه يكون رب الأسرة بيشتغل في وظيفة رسمية في قطاع خاص أو بيشتغل بشكل غير رسمي أو غير منتظم سواء داخل أو خارج المنشأة. وبرضو بالنسبة اللي بيعملوا في القطاع العام أو في الحكومة كانت نسبة تعرضهم للهشاشة أو للصدمات أقل بكثير. طيب من ضمن النتائج اللي توقفنا برضو عندها هي الأماكن الريفية والحضرية. والحقيقة إن إحنا وإحنا بنجري الدراسة دي حسينا إن إحنا بنطرح أسئلة أكتر ما بنجاوب على بعض الأسئلة، لأن في 2018 كانت الأسر المعيشية أكثر تعرضا في الريف للصدمات والصدمات الاقتصادية. اللي شفناه في 2023 إنه الأسر الحضرية أو اللي عايشة في الحضر هي الأكثر تعرضا للصدمات والصدمات الاقتصادية. على سبيل المثال برضو هنا مثلا بالنسبة للقاهرة الكبرى هنلاقي إن حوالي 58% من الأسر اللي موجودة في القاهرة الكبرى تعرضت لصدمات، وده كان مقارنة بأقل كمان من بعض الأسر حتى اللي موجودة في الريف في الصعيد، اللي تعرضت حوالي 53% منهم بس للصدمات. وده يعني ممكن يكون ليه أسباب مختلفة احنا حاولنا ان احنا ننظر ليها. ممكن يكون نتيجة اعتماد الأسر في الريف مثلا على الإنتاج الذاتي أو على السيلف برودكشن بتاعتهم، اللي بتخليهم ما بيتعرضوش أكتر للفلكتويشن أو لاختلاف الأسعار اللي موجود في الأسواق. وقد يكون مرتبط ببعض البرامج الخاصة بالحماية الاجتماعية أو بتكافل وكرامة أو بعض المساعدات الاجتماعية اللي بتكون أكتر متركزة في الصعيد أو في المناطق الريفية مقارنة بالمناطق الحضرية. والحقيقة إنه ده من ضمن الأسئلة اللي إحنا بنطرحها، يعني الأبحاث القادمة، لأنه مهم جدا نفهم الداينامكس دي، وده هيخلينا نعرف إزاي الأسر اللي عايشة في الريف ممكن يكون عندها آليات تكيف مختلفة أو استيعاب مختلف للصدمات مقارنة بالحضر. هنا برضو في الجراف ده، وهو يمكن يكون مرتبط جدا بالورقة البحثية اللي قامت بإعدادها دكتورة إيران ودكتورة هانية، وهو إن إحنا بنشوف إزاي الأسر الحاصلة على برامج مختلفة من الحماية الاجتماعية وتعرضها للصدمات. فهنشوف إنه الأكثر تعرضا للصدمات هي الأسر المعيشية الحاصلة على المساعدات الاجتماعية وعلى تكافل وكرامة، وده بيقل أكتر من 10 نقاط مئوية تقريبا لو شفنا الأسر التانية اللي هي ممكن تكون حاصلة على يعني فرد واحد في الأسرة حاصل على التأمين الاجتماعي أو التأمين الصحي أو المعاشات اللي هي بيزد على الكونتريبيوشن أو الاشتراكات. وده برضو بيكون ليه دلالات مختلفة. قد يكون ليه دلالة إنه فعلا تكافل وكرامة والأسر والمساعدات الاجتماعية بتستهدف الأسر الأكثر هشاشا واللي بتتعرض أكتر للصدمات، ولكن في نفس الوقت قد يكون برضو بيدل إنه لسه في احتياج لبعض السياسات الاجتماعية وبعض البرامج الاجتماعية الأكثر مرونة، واللي تقدر تحمي الأسر المعيشية حتى اللي بتحصل على البرامج دي من التعرض للصدمات في وقت الأزمات. طيب الجزء الثاني من العرض النهارده وهو الخاص بآليات التكيف، ودي احنا برضو صنفنا فيها الأسئلة المختلفة اللي موجودة في البحث عشان نقدر نقسم الآليات التكيف الخاصة بترشيد الاستهلاك، ودي على سبيل المثال مثلا تقليل الأغذية أو استخدام الغذاء أو تقليل الاستثمار في التعليم والصحة. وطبعا دي بيكون ليها برضو تأثير بيحصل بعد كده على رأس رأس المال البشري، وبعض التغيرات اللي حصلت في العمالة أو في الحصول على المساعدات الاجتماعية من الأقارب أو من الأصدقاء، اللي هو بنسميها سوشيال كابيتال أو رأس المال الاجتماعي. وكمان شفنا إزاي الأسر كانت بتقدر إن هي تستلف من الآخرين عشان وقت الأزمة إن هي تقدر تصمد أو تبيع بعض الأصول اللي موجودة عندها. بشكل رئيسي فضلت ترشيد الاستهلاك مقارنة ب 2018 و 2023 هي أعلى آلية تكيف بتقدر تستخدمها الأسر. وبشكل رئيسي في 2023 كان الحصول على غذاء أقل أو eating less food كان هو ده أكتر آلية للتكيف. الأسر المعيشية المختلفة استخدمتها علشان تقدر إن هي تتكيف مع الأزمة الاقتصادية وزيادة الأسعار. وشفنا برضو انه الاعتماد على رأس المال الاجتماعي كان اقل في 2023، لانه بعد ما كان مثلا حوالي 23% من الاسر 29% من الاسر في 2018 قالوا ان هم استخدموا الاليات دي، الرقم ده انخفض ل 23% من الاسر اللي تعرضت للصدمات وقالوا ان هم استخدموا الاليات دي في 2023. من ضمن برضو النتائج اللي احنا حسيناها ان هي مختلفة في الراوند او في الدورة بتاعت 2023 هو النو كوبينج او عدم استخدام اي آلية من التكيف برغم يعني التعرض الأسرة المعيشية للصدمات. والرقم ده كان حوالي 5% من الأسر في 20 في 2018 وارتفع ل 26% في 2023. وده هينقلنا للشريحة اللي بعدها اللي حاولنا نشوف فيها طيب مين هي الأسر اللي ما استخدمتش أي آليات للتكيف برغم تعرضها للصدمات. فهنلاقي إنه في الأسر الأكثر ثراء وحوالي 21% منهم قالوا إن هم ما استخدموش أي آلية للتكيف، والرقم ده ارتفع شوية بالنسبة للفئة الثانية اللي هي الأقل برضو ثراء، 25% منهم. وده قد يكون ليه دلالة على القدرة المحدودة بتاعتهم ان هم يقدروا يتكيفوا او ان هم يستخدموا آليات للتكيف لما بيتعرضوا للصدمات. ولكن في نفس الوقت في حوالي 34% من الأكثر ثراء قالوا إن هم برضو ما بيستخدموش أي آلية للتكيف. وده قد يكون نتيجة الأندر ريبورتنج حصل في الدراسة، أو قد يكون نتيجة إن هم عندهم أكثر صمودا أو أكثر قدرة على الصمود في الأزمات. فدي برضو من ضمن الأسئلة اللي احنا بنتطلع ان احنا ان شاء الله نجاوب عليها في الدراسة القادمة الخاصة بالتعرض للصدمات.
أيمن.
طيب آخر جزء هو الأمن الغذائي. واحنا حاولنا ان احنا نقسم تعرض الاسر للامن الغذائي من الاسر اللي هي فود سكيور او اللي هم عندهم امن غذائي. وبعد كده في 3 درجات من التاثير اللي حصل على الامن الغذائي للاسره نتيجه تعرضها للصدمات. اول ليفل او اول درجه هي البسيطه جدا اللي هو مجرد القلق بتاع الاسره ان ما يكونش عندها غذاء كافي. الليفل اللي بعده اللي هو متوسط تقريبا اللي هو بيكون في تضحيات خاصة بالجودة بتاعة الغذاء أو بتقليل الكميات أو بإن احنا حتى بعض الأسر اضطرت إن هي تفوت بعض الوجبات. والتأثير الحاد على الأمن الغذائي وهي دي الأسر اللي كانت عندها حست بجوع أو قعدت يوم كامل من غير ما تقدر تتناول الغذاء نتيجة نقص الموارد. هنشوف في الجراف اللي قدامنا ان حوالي 60% من الاسر المصريه ما اشروش خالص ان هم كان عندهم اي تاثر في الامن الغذائي بتاعهم. ولكن لما بنيجي نربط ده بالاحداث اللي حصلت سواء الصدمات الاقتصاديه او الصحيه او الاجتماعيه هنلاقي انه التاثر كان متوسط بالنسبه للاسر اللي تعرضت لبعض الصدمات الاجتماعيه، وكان حاد جدا بالنسبه للاسر اللي تعرضت للصدمات البيئيه. طيب هنا برضو شفنا النتائج بالحضر وبالريف. وتاني يعني طرحنا سؤال ان احنا لقينا انه في الحضر موجود اكتر اثر متوسط، ولكن في الريف الاثر كان حاد اكتر على الامن الغذائي. بس هتظل مثلا القاهرة الكبرى من اكثر المناطق اللي كان فيها تاثر شديد او تاثر متوسط بانعدام الامن الغذائي او بالازمه ازاي الاقتصاديه اثرت على الامن الغذائي، مقارنة بالمناطق حتى الريفية اللي كانت الأسر اللي قالت فيها بنسبة أعلى إن هي بتشهد أمن غذائي. وبرضو هنبص على لو بصينا على الدرجة اللي هي السيفير أو اللي هي الحادة جدا هنلاقي إن هي كانت في اسكندرية وفي منطقة قناة السويس كانت أكثر تأثرا بشكل حاد مقارنة حتى بالمناطق الأخرى بعض المناطق الأخرى الريفية. طيب هنا برضو بنشوف نفس الجراف ده بس بالحصول على البرامج الحماية الاجتماعية. وتاني هنلاقي انه الأسر الحاصلة على المساعدات الاجتماعية او على التكافل وكرامة شهدت اكثر تأثر حاد جدا بالامن الغذائي بتاعهم نتيجه الازمه الاقتصاديه اللي حصلت او بعض الصدمات الاقتصاديه اللي تعرضت لها الاسره. ولكن برضو الاسر اللي هي فيها على الاقل شخص واحد بيحصل على تامين اجتماعي او على تامين صحي او على معاشات كانت اقل تاثرا في الامن الغذائي بتاعها. طيب يعني بشكل مختصر جدا البحث ده كان بيشوف انه حوالي 40% من الاسر المصريه تاثرت في الامن الغذائي بتاعها نتيجه الازمه او تعرض للصدمات الاقتصاديه اللي حصلت بشكل رئيسي. حوالي نص الاسر في 2023 او 49% قالوا ان هم تعرضوا لبعض الصدمات، وده كان مقارنه ب 16% بس في 2018. ترشيد الاستهلاك وبالذات الاستهلاك الغذائي كان من أكتر الآليات اللي استخدمتها الأسر المصرية عشان تقدر تتكيف مع الصدمات. وده طبعا ليه دلالات خاصة بالاستثمار في الصحة وفي التعليم وفي الأطفال، وإزاي إن إحنا هنكون بعد كده بنشوف الأمن الغذائي بتاعهم والنيوتريشن بتاعتهم أو التقزم وبعض الانديكيتورز أو بعض المؤشرات الأخرى. شفنا انه بعض السياسات اللي ممكن ان احنا نقترحها ان هي تكون خاصه بانه الاسر المعاشيه يكون عندها كفرج اعلى او تكون عندها تغطيه اعلى ببرامج حمايه اجتماعيه تقدر ان هي تكون مرنه علشان تقدر ان هي تحميهم وقت التعرض للصدمات. طبعا برضو النقطة اللي أشارت ليها الدكتورة إيران وهي الخاصة بسوق العمل، وإزاي إن إحنا نقدر نخلي سوق العمل يكون فيه أكتر تغطية بشكل رسمي وعمل داخل المنشأة هيأثر على التعرض للصدمات وآليات التكيف اللي بيتم استخدامها. وثالث نقطة طرحناها هي موضوع الزيادة اللي حصلت في المناطق الحضرية في التعرض للصدمات أو في تأثر الأمن الغذائي بتاعهم نتيجة الصدمة الاقتصادية اللي حصلت. بشكر حضراتكم ومتطلعة للمناقشة. شكرا.
Thank you so much, Iman. I think both papers have given us a lot of food for thought, but also posed a lot of questions I think that we will need to be answering in the future papers, specifically for the paper that Iman has just mentioned. Some also interesting findings on the urban versus rural disparities, which are not consistent with the previous rounds, but also the coping strategies, which are very important because we sometimes tend to focus more on poverty, but not on the vulnerability and the negative coping strategies by the families. And of course, the food insecurity, and you've mentioned it at the end on children because it can have irreversible damage. Now, we will move straight to our lead commentators. We'll be starting with Soraya Al-Asyuti. Soraya Al-Asyuti is the social protection specialist at the World Bank's Cairo office. She has expertise across a diverse array of sectors with a focus on nexus of social protection, gender equality, and human capital development. She has worked in Egypt, Yemen, Djibouti, and she is currently the task team leader of the Kefal and Karama project and leading the social protection engagement in Egypt. Soraya Al-Asyuti, over to you.
Thank you, Dina, and thank you, Irene and Dr. Hania, for sharing the paper and for allowing me to comment. Of course, it depicts the evolution of social protection in Egypt through the different rounds of ELMPS, which relies on rich set of data that is only made available thanks to the efforts of the ERF and the CAPMAS. And I'm sure with the discussion that we had yesterday and today, there are a lot more topics and questions that will lead to further research and papers. When I looked at the paper, I was trying to map out the different social protection programs and see how do they respond to what we call the needs of the population, but also the life cycle approach. Because the paper, of course, identifies very well where what are the categories that are covered by any sort of social protection, and you kind of limited the social protection in the three pillars that you described at the very beginning: the contributory, the non-contributory, and partially the food ration card. However, since we're talking about how social protection interacts with the labor market and how labor market plays an important role, I was kind of hoping that we could tackle the labor market programs that either are available and not fully utilized, like you refer to the unemployment benefit, but also what other type of social protection programs that could be there and provided to people, but perhaps not captured in the ELMPS. And this can also open the discussion around how do we want to see the landscape of social protection in the coming years. What we learned from COVID and the subsequent changes that happen is that there are changes that are happening in the nature of jobs. The level of formality upon which the traditional social insurance programs and policies were implemented might not be relevant to today's world. So, and the transition, as you mentioned in the paper, the transition between the social assistance to the social insurance is not automatic, and it's not quite apparent. And it might be because, as you mentioned, that there are no proper and decent jobs opportunities in the formal sector that can be provided for this segment, but also when you look at the characteristics of those who receive the social assistance, particularly تكافل وكرامة, the program is by design for the poor and the vulnerable. These people might have a very limited set of skills, might have a very limited education that is not enabling them to formally enter the labor market in its traditional term. And this takes me to the social insurance and how you differentiated between someone, a member in the household that contributes into the social insurance. So in a way, they are in the formal job market and the formal labor market, but also those who are just recipient of the pensions. And it was quite not interesting, but it was good to actually see this on the paper, because the survivorship pension, which is members of the household that can still continue to receive the pensions on behalf of either like the deceased parent or spouse, etc., can continue to get this benefit, and it might prevent them or disincentivize them from looking for other opportunities, because it's quite a paradox. Women are not in the formal market, and we've seen this in the papers yesterday and in the discussion, and yet they are among the main recipient of the pensions. Another interesting finding that I'm sure can open up more discussion and more research is the demographic transition and the demographic shift that happens between the different rounds of the ELMPS. And the way I'm saying that is, yes, social insurance or the contributory schemes remain one of the main social protection programs in Egypt to provide coverage to people. But as you described in the paper and you showed, this is declining. And this is declining because there aren't new entrants that are enrolling in the social insurance schemes like their parents or other perhaps older family members within the household. So again, what can be the policies that can identify the set of households that have limited capacity to get into the formal pathway that you mentioned in your recommendation, but also how can we shift a little bit or try to identify what could be other type of benefits that could look more appealing to these households. As you mentioned, perhaps the contribution rates seem a little bit high. Perhaps they are afraid to lose the cash assistance that they receive from تكافل and كرامة, although it's quite small in comparison to what they could gain in the future. But it's this concept that I have something small yet stable that can help me coping with the shocks, like Iman has mentioned in her paper. And because of the labor market, the jobs opportunities might not be quite dynamic, people can fear that if they lose the cash assistance and then they get into the formal jobs, there are also some risks that is associated with the macroeconomic shocks that can allow people to not to actually and choose not to enroll in the formal schemes. The regional disparity is not shocking, because yes, the poorest are in the rural Upper Egypt, etc. But it can also be a strong message to policymakers. These are the poor. These are only covered by the social assistance. They lack other types of social protections, and the majority of the households in this cohort, they are in working age. Their working age cohort, like they're able and they can work. They can be mapped and they can be offered some sort of the labor programs that were discussed actually yesterday. What kind of skills can they provide it to? We know that there are certain efforts by some ministries, by NGOs, etc., to have this economic graduation and economic opportunities that can be provided for these households that are benefiting from the cash transfer. But it's not enough, because that would allow them to benefit from both, but can it allow them to sustain and maintain their social protection through the social insurance without relying on the cash assistance? This is a topic that we can further discuss. To last point, the child-related SP is of course quite important, and it takes me back to my opening point, is that the life cycle approach. How can we look at like early age and childhood, and then adolescence, and then working age population, and then the elderly, etc., and how we can map the different SP programs wider than that, and then identify what are the gaps. The child-related program, yes, nutrition, as Iman mentioned in her paper, the food security aspect is quite important, but also the ECD. And there are certain examples that can be provided to a household that can enable them to provide ECD opportunities for their kids, and allowing them to get into ECDs, and it can unlock so many other positive multiplier in the economy. The very last point is the reference to early retirement due to privatization. And because I didn't see anything in the paper that described the macroeconomic shocks or the privatization in particular. So it was quite a strong statement in my view, especially that the new law of the social insurance and pensions is kind of limiting a little bit the eligibility for early retirement. Thank you.
Thank you so much, Soraya. We now move to Sekandra Kordin. Sekandra is a research fellow and the country program leader at the International Food Policy Research Institute. Her research includes impact evaluations, mixed method studies, and experimental games aimed at helping to inform the design of social protection, nutrition, and agriculture intervention. Sekandra, over to you.
Thank you so much, Lina, and thank you, Iman, for the great presentation. So I wanted to kind of just put up this table, and it's actually building on what Soraya had just mentioned. I don't think this is news for anybody in the room, but just to kind of focus our minds on when you're talking about reports of shocks in the past year, and you survey people in 2023, there was a huge shock in terms of inflation. And this came up in the framing of the paper, but I think it's worth making it a little bit more explicit. That the food inflation was high even before kind of the Russia-Ukraine war because of kind of global supply chains coming out of the COVID period. But then there was a sharp jump, and then there was another couple sharp jumps that were related with the devaluation of the currency. So this is a context in which I would say everybody in Egypt should have said, yes, there was high food prices last year when you asked them. So in that sense, it's a little bit kind of more of a question, not like talking about the fact that, yes, we found more and more people that reported high food prices. It's a little bit more of, okay, for the people who didn't report high food prices, why are they different? Because we know that the food prices went up. So it's less about kind of are people exposed to the shock or not, and more about kind of a little bit more of a mix, because the self-report on being exposed to a shock is also going to encompass whether it's a shock that you can easily absorb or not. So I think my suggestion would be if it's possible to separate out kind of the food price shock specifically from the other shocks, and then try and explain that a little bit and get more into the story about which households felt vulnerable enough to the food price increase that they even reported it, because you do get into kind of how do you cope with it, but the other possibility is that if you're doing well enough, you might not even report it as a shock. The other thing that you could look at there in terms of some heterogeneity might be depending, and I haven't looked in detail onto the ELMPS, but I'm sure the experts here know, there is some variation in the date of the survey, whether you can use that to tell kind of whether some of these specific dates about kind of the devaluation are affecting people's sense of their vulnerability to that shock. Also, I know you had looked at the ration card, but maybe focusing that specifically for the food price shock and seeing how that protected households. Definitely, I think overall it's very useful in the ELMPS to have this kind of panel survey, and it's really see the incredible value of being able to say that many of the questions were asked the same. I know the paper got into this idea that the food insecurity experience scale was a bit different from round to round, but I think you can still use the panel structure of the data, and I know that was noted as something that is kind of coming up, so I'm very excited to see that as you keep looking. One suggestion would be you can't do kind of a straightforward differences and differences, but you could use an ANCOVA type specification where you put in the 2018 FIES as a control variable. The other thing that you could do would be to use the shock from last round and see kind of how persistent that is. I think that's another kind of question that the panel structure of the data will allow us to really understand. And then the last comment that I had was about kind of the policy recommendations coming out here. And I think you might have added this, or I missed it in the paper, but the formal jobs are also a great kind of reaction, not only targeted social protection. I think as people who work in social protection, we tend to always say, yes, social protection is the answer, but thinking a bit more broadly, also health insurance. I think there's an effort now to expand the health insurance coverage, and particularly coming back to this idea that that huge shock that was an inflationary shock that hit everybody in Egypt. Let's also bring this back to the policymakers and say, look, it's not just about creating the social protection mechanisms, but macro policy can be a little bit more careful about avoiding these types of shocks and out of control inflation. And I think that's important to highlight, that we're really, the vulnerability happened, and it's not kind of a natural shock that happened. It was something that could be potentially better controlled in the future. Thank you.
Thank you so much. I think that we have some time for questions, so maybe let's go for a round of questions, please. And if you can introduce yourself.
Thank you very much. Well, at the beginning, I'd like to thank the whole panel and the authors, because they gave us food for thought, really. Thank you very much. And I tend to agree with Sikandra. All her comments were absolutely realistic and true and should be taken into consideration. I just have three short comments. First comment to Irene. You talked about, you defined the effectiveness of the program as being the scale and outreach of the program. I wouldn't say the scale and outreach is enough, because how much is being given to a family or a household is what really matters. If we give a family of 4 or 5 persons or individuals takaful assistance program worth of 500 or 600 pounds per month, this is nothing really. This is how much does it make out? How much does it represent of their total income? Is it really a big amount? Does it really matter? We know what 500 pounds means. It's nothing, yani, given our situation of inflation right now. So this is my comment to Dr. Silwani. And then Dr. Iman talked about the food insecurity, to what extent, and you showed us that households receiving takaful and karama assistance programs were the household that suffered most of food insecurity. And this confirms what I'm saying. I mean, giving them 500 or 600 pounds a month is not sufficient, because it does not represent anything significant. Finally, I agree. I would like to add a point, since we have someone like Sikandra from IFPRI here. When you talk about support programs or social protection programs, there has been a school feeding program that was going on in Egypt, but it was stopped. I don't know why. Although children are the most vulnerable of all when the prices are high and we are enduring shocks. No one mentions the school feeding programs, and I guess they should be part of the social scheme that goes to the poor population, especially that some of the a lot of the families told us in a previous survey that they would that they would send their children to schools if there were school feeding programs, because it helps the poor family a lot. So this is what I would like to add. Finally, as Dr. Sikandra said, last year the food price inflation reached 74%, as compared to 40% in June and July 23, when the CPI was 40%. The food price index rose, or the food prices rose by 74%. So we do have a problem where food security is concerned. Thank you very much.
Thank you so much, Dr. Eva.
I just want to add a piece of information, because I work in the south and we work with takaful, okay? It's per child, probably 500 pounds, because we worked like 3 years ago and it was 300 pounds per child. But some additional programs were suggested and supported by the World Bank, which meant we were able to applied to the Ministry of Social Solidarity, Social Affairs, as an NGO working in the South, and we were given the support to train the mothers in sewing. So we took and developed a whole program for 3,760 women, and it was marvelous because what we do is create the job close to the homes, and we take care of the children as well, while the mother is at work. So I think that Tekaful and Karama are a big thing, and we should study it to see how useful it has been. Thank you.
Thank you so much. Dr. Raghi, you had a question. If I can just ask you to be brief because we have 5 minutes.
I'd like to just comment briefly on the links to the labor market that Irene mentioned on a number of issues. It's not just a deterioration of labor market conditions. It is a very specific transition in the labor market away from public sector jobs, which have full social insurance coverage, to private sector jobs, which have very partial social insurance coverage. And that transition can be seen in both trends. Why you have a decrease in the people who are covered by social insurance, especially sharply from 2006 onwards, but also why you have an increase in people covered by pensions, because the government workforce is very now an inverted pyramid, where we have a very high rate of retirements from the government workforce as a result of the non-renewal of the workforce, so that we have this huge demographic wage of retirements from government, which is raising the percentage of people who have these social pensions. And that's a temporary phenomenon. Once these people retire, we're going to start having a decline in the people who have pensions. So it's part of the demography of the government workforce. The other thing I was curious about is you said you looked at the transitions from non-contributory to contributory. I'm actually quite interested in the opposite, the transitions from contributory to non-contributory, and to see to what extent people are abandoning contributory programs in order to get eligible for Takaful al-Karam.
Thank you so much. We'll take a couple of more questions. Dr. Nesma.
Good morning. Thank you for your excellent presentations, Dr. Iman and Dr. Eran. Actually, I have a question. Did you study this 69% of households that doesn't covered by social insurance or social protection? Did you study the characteristic of them? I think you need to add, for example, another dimension about poorest people, or Q-Wealth index, for example, quantile index, for example, for those people to know, to help the decision maker if this 69% are all poor, are all out of poverty circle or in poverty circle, and those who are coverage are in poverty circle or out of poverty circle also. Thank you.
Thank you.
Thank you very much. Very briefly, and congratulations for the brilliant presentations. I'd just like to reiterate what was said by Dr. Alia about the macroeconomic policies, because of the reduction in the value of the protection. So this is a fact. Second, I think with regard to policy that Dr. Irene mentioned, I think that contributory systems are not only about retirement pensions. They are about unemployment, about employment injuries, about disability benefits. I understand, of course, that the Egyptian economy may not be in a position to cover all of these benefits, but I think it's important to emphasize that in policy. Social protection should be expanded. It's not only about pensions. So this is what. And then I have a question, in fact, about the shocks in the different quintiles. the shocks must be different. So what do we mean exactly by shocks in the wealthiest quintile and in the poorest quintile? So and the coping mechanism for this. So this is my question. Finally, with regard to coping mechanism, 26% do not have any coping mechanism, and there is an increase in the reduction of consumption, of course, and reduction in other coping mechanisms, because of course you cannot borrow from your family or your friends if they all are reducing their consumptions. So in fact, I think this should be could be emphasized. This could be emphasized. Thank you.
Thank you so much. I believe Dr. Shireen will have some questions online as well.
Well, there are more comments than they are questions. Dr. Ibrahim actually addressed the coping mechanism, so I'll skip that one. The couple of other comments that are there about it's essential to redefine families living in poverty. For example, a dormant domestic worker receiving multiple means of income directly from people which aren't captured anywhere. Even though they are still receiving government cash transfer schemes, which limits options for other families who can't cope with the shocks. And another comment that deals with, I hope we can work on the types of jobs in connection with the social protection schemes, especially those in the informal sector, to be able to provide policy option on the reallocation of social protection schemes, especially cash transfers.
Thank you so much. So it's a lot of questions and comments. I'm not sure how you're going to address it, but maybe I can give you 1 minute each to reflect quickly. Irene, you want to start?
I'd like to thank you all for the very rich discussions and comments, and thank you, Soraya, for all the comments. Thank you, Dr. Alia, Rogi, all the questions. I'll very briefly, now we have to agree that social protection programs are wider than just non-contributory and contributory schemes. We have to agree that. So it's also about health, the quality of health care services, the quality of education. It's really a comprehensive concept. But then to capture it in terms of coverage and data, we have to be a little specific. I know it's not comprehensive, but it is a step. Dr. Alia, about the effectiveness, it is only called effective coverage according to the ILO social protection reports. It is not about risk insurance, risk mitigation, its effectiveness in income distribution. It's not about how effective are these programs. It's only, I don't know, a cliche title. Perhaps the accurate term, it would be coverage by any of these three forms, which I tried to mention many times in my presentation. But then there is an excellent paper by Sikandra on the panel, and there is an excellent paper on the effectiveness of food subsidies and cash transfers on the welfare gains in Egypt that was done and very recently published in 2024, where they actually simulate between the welfare gains of expanding takaful or takaful and koromo, and she can actually address that part on the welfare gains and the income redistribution. Back to my point on the social protection and that it is comprehensive. Training opportunities and whether the state give training and how to help bridge the gap in skills and employability. I think training component is very important. We try to, there are questions on training in the ELMPS. We try to capture that and measure that, but the coverage is really low. So So this is perhaps an area of future research. ELMPS also had the questions on the temporary cash transfers that the state has disbursed for the irregular workers, أهالينا. So we reported that in the paper as well. So we tried to capture all the benefits that can be captured in percentages. But some programs would be harder than others. The big question is what is the linkage between contributory and non-contributory? How both programs affect each other. Are they creating disincentives? Is it about non-affordability? Is it about a skills gap? So this is really like a future research area that we need to understand further and to examine further. And to Dr. Ibrahim, your question about social insurance coverage. So in the schemes, so anyone who is covered by social insurance in a formal job is entitled to employment injuries, medical paid leaves. So it's having a family member with a social insurance coverage partially captures access to other benefits in the job related to paid leaves, employment injuries, etc. So my point about that lead me to a point on social insurance schemes. Now, we face, the world is facing the rise of new forms of employment. Digital platform workers, new forms of employment every day. The question is, how relevant are the Bismarckian, not very fan of titles, but how relevant are the defined benefit social insurance contributions for the realities of today's labor market? I think the focus should be on adapting schemes to today's jobs, to challenges in the labor market, finding up ingenious solutions. And I refer to Dr. Hiba on her work on training and empowerment, finding out national solutions that really work and empower people. Thank you.
Thank you so much. Iman?
Thank you so much. I think I will be brief and I will try to tackle some of the points. So starting with Sikandra, I guess I agree with all your comments. I agree with Dr. Ali about your excellent comments. We tried in the paper to have a look or to address how the macroeconomic shock had been reflected by numbers, by food inflation indicators and by others, but we would be happy to extend this section as needed to make the context more stronger when it comes to the macroeconomic shocks. And I think one of the key contributions of this paper is to try to make the linkage between how macroeconomic shocks had affected households through the ELMPS module on shocks. For the characteristics of non-vulnerable households or those who reported not being exposed to shocks, maybe in the presentation I didn't emphasize this part, but in the paper we covered this by looking at the education level of those who did not report any shocks, by the wealth quintiles, by the formality of jobs compared to those who reported being exposed to shocks. So I guess this part is more maybe covered in the paper. On the panel data analysis, yes, it's under preparation, and I think you give us some food for thought also for the panel analysis, because we are planning to look at how households who were affected in 2018 and also in 2023, what are the characteristics, and to look at the chronic poverty. Maybe this could be also an additional point to be added through the panel analysis. On the policy recommendations, also happy to emphasize more on the macro policy and the expansion of the private sector and formality of jobs. We tried to cover a little bit on labor market reforms, but we can strengthen this point. And with Dr. Ibrahim also, I agree with your comments, especially on social capital, like how can we depend or rely on social capital when everyone is being affected by the shock? So I guess this is also a very good point that we can try to emphasize in the paper. And we looked again at different quintiles and different exposure by type of shocks in the paper. So maybe the presentation was a little bit brief in that part, but happy to discuss it further based on the paper. Thank you.
Thank you so much for the researchers, for the panelists. It was indeed very interesting. And I think that with this, We will be closing the first panel. Thank you so much, everyone.